Hi, my name is Bonnie Kerker, and I am part of the Department of Child and Adolescent Psychiatry here at NYU, and I'll be doing this webinar today. I wanted to first of all just thank you all for tuning in and for taking the time out of your busy schedules to join me, and to let you know that if you should have questions throughout the presentation, that you can submit them at any time by typing into the questions panel on the right-hand side of your screen. We'll answer questions at the end of the webinar. So today, I'm going to be talking with you about prenatal and parenting blues and what to do if the sadness won't go away. Okay, so just to give you an overview of what we'll be talking about, I'm going to start by going over some myths and realities of motherhood, and then talk about common complaints, postpartum depression, and baby blues, and try to make some distinctions among those. And then really focus in on postpartum depression and talk about why it's so important to identify symptoms, and then what to do if you see those signs and symptoms in you or somebody that you know. And then we'll end by talking a little bit about how we might be able to prevent some of the signs and symptoms of postpartum depression. Okay, so let's start with myths versus realities. So becoming a mother is supposed to be one of the most exciting and joyful experiences for a woman. That's what you see in the media, in the movies, in magazines. You often see a picture of a very well-rested woman with her hair and makeup perfectly done, holding a sleeping baby and just glowing all over. And the reality can actually be quite different from that. So I think it's important to spend some time talking about what to expect and what reality really is, so that you're not too disappointed when things might be different than they seem in the movies and on TV. The first myth we'll talk about is that new motherhood will be the happiest time in your life. Motherhood can be incredibly rewarding and filled with so much joy and happiness. It can be the absolute best time of your life. But child rearing is also incredibly demanding and can be stressful and can be really complex and overwhelming for women. It's a 24-hour-a-day job, and you don't get paid monetarily for it, and you don't often get breaks. And so it's something to think about ahead of time and to be prepared for. Another common myth is that you can take care of a baby on your own. Often this is culturally based. Women think, oh, my mother did it, my aunts did it, my grandparents did it, I can do it too, and if I don't, I'm not strong, and if I don't, I'm a bad mother. But honestly, the strength comes from knowing when to ask for help and knowing who to ask for help from. Because if you are completely overwhelmed and not asking for help, that's really not a strength. And letting people into your life and allowing them to help you and your family not get burnt out is really the sign of strength of a mother. And then the final myth I'll talk about today, and there are plenty more, but the final one that we'll talk about today is that your relationship with your partner will just grow and flourish once the baby's born. Now, it is true that having a baby can bring people together and have closer bonds, and really, having that new experience together can really be exhilarating for a couple. But it's also really hard work. And there are new responsibilities, new roles, new shifts that need to take place. And oftentimes, women can feel very overwhelmed, even if their partners are really trying their best to help. They might not be helping with the exact things that the woman needs. And so as we'll talk about a little bit later, understanding what you need and asking for those things becomes even more critical during this time. So now we're going to focus a little bit on common complaints, postpartum depression, and baby blues. Some things are very common among women who have just had a baby. Women often think, oh, I can't feel anything, I have no interest in doing my normal activities, I can't get going, I can't stop eating, I'm not hungry, I'm sleeping too much, I'm not sleeping enough, I'm nervous, I'm jittery. There's lots of emotions and feelings and hormones going on during that time. And I think one of the more important things from this webinar today is to understand that these are common and that you're not alone, and most importantly, that you're not to blame. These are not signs of being a bad mother, and that you can feel better. So let's talk a little bit about how to know whether those feelings that I just talked about are common baby blues, which up to 80% of women experience within the first few days of delivering, and when they actually cross the line into something we call postpartum depression, which consists of more severe symptoms that really don't go away and generally do require professional attention. So here on the left side of the slide, you'll see some symptoms that are commonly thought to be baby blues. They're a little bit less serious. They generally go away after not too long a period of time. On the right-hand side, you see symptoms that, if they persist, really do require professional attention. So for example, you might, on the left-hand side, you might see you can take care of yourself and your baby, right? You might be feeling down, you might be feeling blue, but you can take care of yourself and your baby. On the right, with postpartum depression, you'll see we have listed that you're unable to cope with your life or your baby. You might not be able to concentrate or focus at all, have intense feelings of sadness, not just moments of sadness and mood swings, as you'll see under the baby blues. Under baby blues, you might really need a break from your responsibilities and the baby. But if you're having symptoms of postpartum depression, you might be completely avoiding the baby altogether. So you can see there are some distinctions between these two groups, and it's helpful to think about these ahead of time so you know when it's necessary to seek professional help. But above all else, if you ever feel like you might hurt yourself or your baby, or anyone else for that matter, it's really essential that you contact your healthcare provider right away, or 911 if it's an emergency. So let's focus a little bit more on the serious symptoms of postpartum depression. There are certain risk factors for postpartum depression, meaning some people might be more likely to develop it. If women who have a history of depression or bipolar disorder, alcohol or drug use, have suffered a recent stressful event, have relationship problems, financial problems, or previous pregnancy with depression. But by no means does this mean that women with these risk factors will develop depression, and by no means does it mean that women without these risk factors won't. Perinatal depression can affect any woman, regardless of age, race, income, culture, education, anything that you can think of. And really, it's really important to recognize that it's a health problem. It is not the fault of the woman. It doesn't mean that you're weak. It means that it's a medical condition that we need to get help for. So depression is actually not that uncommon among new mothers. Depression among women is most likely to occur when they're pregnant or in the first year of their child's life. There are studies that show that between 10 and 20% of women who suffer from postpartum depression, and 7 to 15% of those occur within the first 3 months of the postpartum time, but really it can start anytime within that first year after birth. So why are we focusing so much on postpartum depression? Untreated postpartum depression can have negative long-term consequences both for women and their children, and their entire families for that matter. Women who are depressed might get less joy out of life and motherhood, and we don't want that, right? We want women to experience everything that they can and get the joy out of life that they deserve. It's also been linked to other health issues, and the longer it's untreated, the harder it might be to actually treat. So we want to try to nip these things in the bud as much as possible. Depression in mothers of infants has also been linked to issues for their children. It has been linked to reduced attachment to newborns, so less bonding with their babies, reduced healthy behaviors among women, so that means things like taking their babies for well-child visits, getting their vaccinations, not breastfeeding as long, and doing things like not using car seats in the car or placing babies down on their stomach, which we're not doing these days. Young children whose mothers are depressed are also more likely to have an increased use of emergency care use and a decreased use of preventive services, as I mentioned earlier. And maternal depression has even been linked to longer-term outcomes in children, such as poor cognitive outcomes, mental health problems, and even food insecurity for the family. I know I sound like a, bad news Nelly, or I don't know, I'm not good with those phrases, but the good news is that help is available and that we can get help if we recognize these symptoms and reach out. So the key is exactly that, recognizing the symptoms and reaching out and understanding how important it is for both you and your baby. So for some symptoms and for certain things that people might be dealing with, leaning on family and friends really might be enough to get them through. And when I say leaning on family and friends, I don't mean that people have to come in and, do all of the child care and babysit every night. It could be a 1 hour a week break that would be super helpful for you. And those are the types of things that you want to think about ahead of time so that you can talk to people and see who might be available to give you those types of breaks that you need. Even just sharing your feelings openly can allow you some needed support. Other symptoms, when things seem a little bit more serious, really require you to talk to your healthcare professional. And doctors, any of your doctors, whether it's your OB, your pediatrician, will be able to help link you to the types of professionals that will be of most help. Support groups are another incredible support for women when they've had babies. There might be other women, I'm sure there are other women who are going through similar situations as you, and just being able to recognize that and talk about the things that you're feeling can be incredibly helpful. And I'm going to give you some information about finding a group in a few minutes, but your healthcare provider often can help you find that group. And then talking to a mental health care professional really gives you a safe place to express all of your concerns, all of your feelings, and they can really help you with managing your symptoms and getting you back to being in a better place to be able to enjoy your family. It's also incredibly important to focus on wellness. So we're going to spend more time in a couple of minutes talking about this, but taking care of yourself in every way, because if you don't take care of yourself, there's absolutely no way that you're going to be able to take care of anybody else. So this means physically, as far as eating a healthy diet and exercising, and as well as mentally, and taking breaks, as I've said, and doing pleasant activities, doing things that are fun for you that can make you feel good. So here are some resources. On the left, we have some support groups. As I said, your healthcare provider should have information on finding a group in your area. If you've delivered or are planning to deliver here at NYU, there's information here on a New Mom support group that I would highly recommend. And there are also often neighborhood-based moms groups listed on listservs, hanging up in coffee shops, just by talking to people that you see strolling their babies. You can find out some more information. And if you're involved with a faith-based group, they also often have support groups for new moms. On the professional assistance side, talking to any healthcare provider that you see can be really, really helpful because they can link you to somebody who is right for you. And there is an agency called Postpartum New York. Their phone number and website is on the screen. And they can also link you if you put in your zip code and your, and you put in, I think you can even put in your insurance type. They can help you find somebody that is right for you. So let's talk a little bit about prevention. I don't want to imply that we can completely prevent postpartum depression, but I do think there are things we can do to help minimize symptoms that we might be feeling. So again, as I said earlier, I think thinking ahead of time and being prepared for what happens when a baby enters your life is really important. It's okay to recognize that there will be losses, there will be things that change in your life that you might not get back for a long time, and that's okay. And I think it's much better to put those on the table, recognize them, so you're not surprised when suddenly you have this weird feeling of loss and you don't know why. At the same time, it's really important to think about the different gains that you're going to have in your life, because having a new baby brings lots of wonderful things into your life as well. And so thinking about those two things together and understanding the balance can be really helpful. So this is a mother's survival kit, and on the left side of the screen you'll see the different things that we recommend that people do to help take care of themselves and to help survive this period. And on the right, we have different things to put into your survival kit to remind you to do those things. So if we look on the left first, you see a lot of the things we've been talking about. To nurture yourself physically, make sure you get the right amount of rest, you're sleeping, you're getting a healthy meal, and you're exercising, even if that means taking a walk around the block, just getting yourself moving. Taking breaks or mini vacations. So as I said, if it might be that you know of another new mom and you can watch each other's babies for 1 hour a week. You can sort of switch off helping each other so that you have that hour to go for a walk around the block or do something else that's meaningful to you. Give yourself credit. I remember when I first had my first child, just taking a shower was a huge accomplishment. And we need to give ourselves credit for things like that, because these are things that that take a lot of work and effort that you might not realize if you haven't been in that situation. Plan at least one event per day involving another adult. This could just be a phone call, but just something to keep your mind moving in a certain way. Plan for something fun. We're going to talk about pleasant activities in a moment, but this is really critical. And remembering to ask for help. And when we talk about asking for help, I think it's really important to think about what's feasible for the other person to do, and what really do I need? Am I going to ask somebody to babysit 5 nights in a week? No, they can't do that, and it's probably not going to happen. But it would be very useful to have somebody come once a week so that I can go do something, or to switch with somebody, as I said, to share responsibility. So nobody's spending money, we're just sort of, helping each other out to give each other the break that we need. So you can see some of the things in the survival kit that we have here are like a puzzle piece to remind yourself that you're an important piece and that you need to take care of yourself. A scented candle to plan a fun, relaxing bath. On the bottom, there's some space here for you to think about what would be in your survival kit. What would help you stay centered and take care of yourself? I like to run, so I might put a pair of running shoes in my survival kit. Think about what might go in yours. And when we think about doing things that we like and doing things that are fun, we have to remember that when we're feeling stressed or down, it might be really hard to do those things. That's the time when we don't feel like getting up and going out. We don't feel like taking that walk around the block. But the more down you're feeling, the less you're going to do, and then the less you do, the more down you're going to feel. So it's quite a vicious cycle. And so if we can get ourselves to make that move and do a pleasant activity, even if you don't feel like it, it can really raise your spirits, and that's a very empowering thing for us to be able to do for ourselves. Remember that up to 40% of your happiness has been found to be based on what you do. There are lots of other things that we can't control, but we can control what we do, and that can really help make us feel better. So here are just some examples of pleasant activities. I suggest here doing at least 3 per week. If you can get that up to 5 at some point, even better. But they can be small things. They don't have to take a lot of time, and they don't have to take a lot of resources. It can be reading something, or listening to music, or walking around doing your daily chores while singing or listening to music, taking a hot shower, or it could be something like getting a pedicure or getting a massage if that's something that you like to do. Think of what works for you. What works for you won't work for your neighbor, and that's okay, because this is completely personal. And here's just an example where you can actually plan it out and hold yourself to it. Say, okay, on Tuesday at 10 o'clock, I am going to go for a walk around the block. And when you're done, check off how satisfied you feel. And I bet you'll feel a little bit boost in satisfaction after you do your pleasant activity. And then finally, getting back to asking for help, think broadly about who you can ask for help from. It might be a family member, but it might be someone you know from the health profession, or it could be a friend or someone from your faith-based organization. It could be someone from work or a neighbor. Think about who it is and talk to them about maybe things that you can do for each other, and try to set up that help ahead of time so that when you're in the throes of feeling down, you don't have to first try to come up with who these people are. So I just want to take a minute to point out some of what I think are the most important points from today's webinar. The first is that postpartum depression is not uncommon. It does happen to women, and you're not alone. Reaching out for support is the biggest act of strength that you could do. Staying quiet is really will not help you and will not help your baby and will not help your family. So recognize the signs and the symptoms and think about what you would do if you saw those signs now ahead of time. And as I said, it's so critical to take care of yourself. If you don't take care of yourself, there's no way you're going to be able to take care of anybody else. It does take a village to raise a child. No one can parent alone. So remember, ask for help. So thank you so much for your attention during this webinar. I wanted just to point out that there are several people who have been involved in the development of not just this presentation, but these concepts. So I wanted to give a nod to them. Okay, so we have some questions. Are there any prevention measures or practices that can be done prior to giving birth that may reduce the chances of experiencing postpartum depression? That's a fantastic question. And I think most of what I talked about today can be done during pregnancy. I think particularly doing pleasant activities and getting used to doing that, making that part of your routine can be really helpful so that when the baby is born, you're not changing your routine. You've already thought this through. You've already figured out what works for you, and you can just try to continue that as much as possible. Thinking ahead of time of who might be able to help you and what types of help you might be important to you. Everybody's different, and you know best what might be useful for you. Now, granted, it's sort of hard to really know until the baby comes, but you might, just knowing yourself, have some ideas of what might be helpful for you. And so talking that through with people ahead of time, brainstorming about how to meet those needs, I think can be really, really important. Okay, my sister had a baby girl recently. She seems very tired and overwhelmed. I'm concerned she might have a case of baby blues or postpartum depression. While we are close, I'm not sure how to approach her about this. Do you have any suggestions about how to talk with her? So I really, really appreciate that question because that is a big issue. And I want to thank you for recognizing this in your sister and congratulate you because this is the first step to getting her help. And without friends and family to recognize these things, sometimes it's hard for people to recognize them themselves. It's definitely a tough situation, and I understand your hesitation. I think the key thing in talking with her is to not be judgmental and not just go in and say, hey, I think you might have a case of baby blues or postpartum depression. That probably will not lead to the results that you're looking for. But you might want to just talk with her about how she's feeling and talk with her about different options for getting help that might be useful to her. And a good way to do it is to think about a time in your life when you've needed help, and you can say, yeah, I may not have been through this. I don't know if you've had a baby or not, but you could say something like, yeah, I remember when I was feeling down when such and such happened. It was really helpful when I did this. Or you can just say, I've noticed that you've how have you been feeling lately? And get her to talk a little bit about that, and then maybe be able to suggest some places where she might be able to get some help. Okay, at what point does treatment for PPD, postpartum depression, require medication? There are lots of different treatments for postpartum depression, and some involve medication and some do not. And that's really a conversation that needs to happen between you and your provider, or a woman and her provider. There are lots of different things to take into consideration, and there's not a one-size-fits-all answer to that question. So I'm sorry for that, but I do encourage you or anybody else in that situation to talk to their provider about it, because medication could be a good answer, but it doesn't have to be. There's lots of different alternatives and definitely worth exploring. So again, I want to thank you for your time today. And on behalf of the Child Study Center, we're really glad that you were able to join us. Once you leave the webinar, you will receive a survey, and we'd appreciate it if you would complete it. You'll also receive a follow-up email within 24 or 48 hours with a link to the recording of today's webinar. And just to put in a plug for our next webinar, which we hope you can join, which will be on August 9th, which is Tuesday at 1 p.m., and it will be on safety skills for kids with ASD. So thanks again, and enjoy the rest of your afternoon.